So cross-border healthcare fraud benefits first of the non-uniformity of the different systems in the European Union. And this diversity of systems for healthcare has to be maintained. It's very important. But we have to work first to have more information about frauds. More data should be collected. And we have also to work on a more harmonized kind of data to compare them. So this is for me the first step, the data. Then we have to organize more collaboration between the member states, more exchange of information. This is really very, very important in the topic of healthcare, but in all the topics concerning the European Union, cooperation and exchange of information. And then, of course, we have to work on a European framework to organize things, and so this will be our responsibility, and I think the European Parliament can and has to work in this sense.
Together with the AIM, we are today here at the European Parliament for raising awareness about cross-border fraud. Each state in the European Union has a specific healthcare system with specific rules. That leads, when you combine those systems from one quarter to another, it combines friction, because those systems aren't identical. Fraudsters are just using those differences and loopholes to commit the fraud, so we really think that there must be an awareness on cross-border fraud, and we truly believe that on European level initiatives can be taken.
Cross-border healthcare fraud is a topic where collaboration is extremely useful, because when there are cross-border healthcare fraud cases, it's good to have a network of contacts on the other side of the border that know that healthcare system and have a national network of people that can help you to tackle the fraud case.
The EHFCN signed in 2013 an agreement with AIM for working together. The main focus of the AIM is the patient, while the main focus of the EHFCN is the public administration and private companies who are combating fraud in all different aspects. We think combining those two focuses that is really creating an added value.
AIM has good contacts with the European institutions, and it is important to know what the European Commission is doing to tackle cross-border fraud, and it is important that we inform the European institutions about what we think that needs to be done at European level to tackle this issue.
What we currently work on is, on behalf of our member states, that we are looking into the matter of the care providers which have been sanctioned. Because as you might be aware, whenever you are sanctioned in one country, there is not necessarily a repercussion in the other country, and so there's fraud possible in a way which is unacceptable. The EMI system, which is internal market surveillance system, is not, in our eyes, ideal in that context, and that's why we believe that we have to work very much on exchanging data, on having made that the national legislation are not harmonized together, but that we can work together to try and find out what the phenomena is. The second question which we're looking at is the financial flows which exist between the countries, and to have it that there again there's adequate data transfer between the administration so as to avoid medical shopping.